And now we will move to the scientific portion of the briefing. Dr. Michael Hendryx, if you would come up and share your findings.
Well, thank you all for being here. It's difficult for anything that I might try to add to the kinds of evidence, information, experience that you've already heard. But I do want to try to summarize for you just very quickly the studies that we've done over the past about 7 years now that have shown that the problems that exist in these mining communities are real, that the people who live in the mountaintop mining areas of Appalachia do experience higher death rates for all-cause mortality, for certain forms of mortality such as heart disease, lung disease, and some types of cancer, including lung cancer. Our data show that these higher mortality rates are not just because of smoking or age or education or poverty or access to doctors. There's something about living in these communities independently of those other risks that leads to higher death rates for the people that live there. In addition to studies of mortality, we've also looked at other types of survey data about what people say about their own health. Rates of self-reported illness are also higher in these communities in ways that are not explained by other variables. So we see the same kind of pattern in what people report that we see in the mortality data. That is, experiences with cancer, both personal experience and family experience. People in your household who have died of cancer. We see heart disease and lung disease, things like COPD. Very common in these areas. In addition to those, we've done some door-to-door surveys, one in Kentucky and one in West Virginia, and have confirmed that the people that live closest to these activities are more likely to report a wide variety of illnesses that are not accounted for by other variables. One of the studies that we did was a study of birth defects. We looked at a very large sample of live births over a 7-year period, looking at all the births that took place in the 4 states where mountaintop removal takes place: Kentucky, Tennessee, Virginia, and West Virginia. And we found that there was a higher rate of birth defects across all different types of defects, or most different types, that was related to living in the mining area. And again, not because the mother smoked during pregnancy or used alcohol or had poor access to health care. It was something about the mining. We found that the rates of those birth defects actually increased in many forms over recent periods versus earlier periods. As the mining activity intensified, the mining-related effect got stronger. We also found that if you lived in adjacent counties, that there was an effect. So you didn't have to live just in the county, but you could be living in surrounding counties that was near it. And there were still also evidence of a problem. We compared the size of the effect between living in a mountaintop mining area and more conventional risks like smoking. And we found that the odds for a mother to have a baby with a birth defect who lived in a mountaintop mining area was actually higher, a lot higher, than if the mother smoked during pregnancy. When you look at the overall pattern of these results, one of the criticisms that's been raised about these findings is that we have these correlational studies. We know that people who live in these areas have these problems. We didn't know it, or we hadn't done studies that have directly linked what's in the environment, what's in the air, what's in the water, to the exposures that people were getting. So it was criticized for being correlational. But if you look at the whole pattern of studies, there's over 20 now. There's about 25 published peer-reviewed studies on this topic that document these different problems. And it's not just a correlation. We see that the effects get stronger as the levels of mining go up. that the effects are worse where mining is heaviest, they're intermediate where mining is intermediate, and they're best, the health outcomes are best where mining is absent. We see that the effects have gotten stronger in more recent years as the mining activity has intensified. We see effects not just for men, which might indicate an occupational exposure effect because most coal miners are men. We see effects for women and for children's outcomes as well. And I think it's also really interesting to look at the pattern of where we don't see effects. One of the main areas where we do not see a mining effect is for diabetes. When you look just at diabetes rates in mining communities and you don't control for things like obesity or poverty or other risks, the diabetes rates are higher in the mining communities. But when you control for those things statistically, there's no longer a mining effect related to diabetes. It goes away. We know that type 2 diabetes is related to diet and exercise, okay? And we're able to control for those risks and show that there's no independent effect for diabetes, but there is an independent effect for lung cancer, for heart disease, for lung disease, for self-rated health, for symptoms across a wide variety of problems, for birth defects. More recently, we've been trying to go beyond the epidemiological data to examine what those real environmental conditions are. And Mike McCauley is going to summarize some of that for you, but we're finding evidence that, in fact, when we look at where people live, at their front yards, that the air quality is impaired, that the drinking water is impaired, that these are real concerns. This is not just some correlation that's accounted for by some other variable. The environmental conditions in these areas are impaired, and the health the health status of the people that live in these communities is impaired. Those are facts. And we have more than enough information, in my view, to take action. Mountaintop removal should stop. It is not done in an environmentally responsible way. It is a hazard to public health, and it's not even economically advantageous, as was described earlier. One of the studies that we did looked at the economic contributions of coal mining to the region. And we compared that to an estimate of the economic costs associated with all of the premature mortality. And the cost of the coal mining economy for Appalachia outweighs its economic benefits 5 to 1. It's not economically advantageous, it's environmentally destructive, and it's harmful to human health, and it should stop. I'm going to turn over now to Mike.